Hi, I'm Armin Zadeh. I am the Director of Cardiac CT at the Johns Hopkins Hospital in Baltimore in the Division of Cardiology. And I am grateful for the opportunity to tell you a little bit about our latest research with ultra-high-resolution computed tomography. What is ultra-high-resolution CT? Well, it is CT imaging with improved spatial resolution. And there essentially are two principal ways to improve spatial resolution with CT. You may have heard of photon counting CT, which has been recently released commercially. And essentially that takes a better advantage or better use of the X-ray information from CT imaging. The traditional way of improving spatial resolution had been to decrease the detector width of CT imaging, because essentially the smaller detector width, the better the spatial resolution. And the latest conventional CT technology had used a slice thickness or detector width down to 0.5 millimeters, the smallest. Ultra-high resolution CT, which was released almost 3 years ago now commercially, uses a slice thickness down to 0.25 millimeters. Now, essentially what that means is doubling the spatial resolution compared to conventional CT. That's a big deal. So it's really a major advance in terms of spatial resolution. Now, there are downsides. So the smaller detector width, the greater your image noise. And so the question still is whether that better spatial resolution will not come at too much of a penalty in terms of image noise. Unfortunately, there are ways now using artificial intelligence algorithm, a deep learning algorithm to reduce image noise. So we are quite excited about the ability now to use ultra-high resolution CT. And the potential applications are plentiful. I mean, any structure, essentially, any small structures detectable in the many imaging fields, could be advantageous. And we're just seeing the initial or some of the initial studies, looking at the potential application of ultra-high resolution, in brain imaging, in oncology, even bone imaging, and so it's really a quite exciting time for medical imaging. We are particularly interested in cardiac imaging, and specifically in the question whether ultra-high resolution CT may overcome a major limitation of conventional CT for coronary imaging in the setting of dense coronary calcification or coronary stenting, because these high density structures such as calcium or metal from stent lead to what we call blooming artifacts, which essentially is overrepresenting of these structures in our current image reconstruction algorithm. And it largely results from limited spatial resolution. And so our hope is that by improving spatial resolution or using scanners with improved spatial resolution, we actually will have a reduced effect of that blooming artifact. And that is the hypothesis we are currently testing in a clinical study at our institution. So for this purpose, we are comparing the diagnostic accuracy to detect coronary artery stenosis by ultra-high resolution CT in patients with conventionally by conventional CT considered very challenging populations, that is severe coronary calcification and or prior stenting, and comparing the results to the standard of invasive coronary angiography. And we just published our initial observations, the first 15 patients in our study, and the results were very encouraging, meaning that the diagnostic accuracy of ultra-high resolution CT appears to be very high, much higher than we typically would expect with conventional CT in this challenging situation. And the population indeed was very challenging, as the average calcium score in our cohort was 1200. So these are patients really with very severe coronary calcification and or coronary stenting. And yet, in a patient level, the accuracy actually was perfect, was 100%. But these results are fairly preliminary, and need to be confirmed in a larger cohort. But we are hopeful that ultra-high resolution CT indeed, may become a new standard, for coronary artery disease evaluation, in this high-risk population, and maybe eventually even challenge invasive angiography as a standard for coronary artery evaluation. Of course, and again, there are lots of other applications of ultra-high resolution CT which are being tested right now, and so we'll expect to see a lot more results over the next few years coming from this exciting new technology.